Telomeres. You heard the word, but did you pay attention? Do you even need to, though? Find out if telomere lengthening is important for your cancer journey or detrimental, and what you can do or shouldn't do to support these little guys. Hi, I'm Dr. Lisa Mateka, naturopathic physician, energy worker, and transformational life coach, and I help women in their 40s to 60s with cancer who are paralyzed by fear, drowning in conflicting advice, and unsure what steps to take next to regain their emotional center, inner strength, and personal power by guiding them through a truly innovative, comprehensive, holistic system. They are empowered to pursue a path where the odds of a full and deeper healing are definitely stacked in their favor. So you may have been hearing a lot about telomeres in the, alternative medicine space, so to speak, holistic space, biohacker space. And as you may know, telomeres are these little end caps on the chromosomes. The chromosomes are where DNA is stored. And the telomeres are also made up of DNA, and they're like these end caps on the chromosomes to protect them every time they divide, so they can divide fully and completely with no loss of our genetic information. And the thing is, though, every time they divide, the telomeres get shorter and shorter and shorter. And eventually, this leads to cell death, aging, and in some cases, disease. At least that is what people are saying. So shortened telomeres leads to aging and disease. Now, first we have to find out, is this entirely true? And there is conflicting evidence on this whole shortened telomeres leading to aging and disease like cancer. So I'll actually tell you about a meta-analysis that specifically studied shortened telomeres and cancer. This meta-analysis consisted of studying 27 different studies on the topic to kind of compile the final results, if you will, of all these other studies. A meta-analysis is like a study of studies. So there were 27 studies involving 13 types of cancer, and this is what they found. So yes, there was found to be an association between short telomeres and these particular cancers: bladder, head and neck, esophageal, gastric, ovarian, and renal. There was not, I repeat, there was not an association between shorter telomeres and prostate, endometrial, also known as uterine, or skin cancers. So any of the skin cancers, prostate, uterine / endometrial, those cancers were not associated with shorter telomeres. And the data was inconsistent for cancers of the breast, colorectal, lung, and non-Hodgkin's lymphoma. So really that category with the inconsistent data contains the majority of people's cancers. So there you have it. So here's the thing. What I'm going to be talking about is going to matter depending on what stage you're at. If you're prevention, you'll take a whole different approach than if you actively have cancer. So let me explain telomerase. So telomerase is an enzyme that is naturally found in some tissues more than others, like the tissues where the cells are rapidly dividing, sex organs, skin, things like that. There's more telomerase found. And what it does is it does help to lengthen the telomeres. So it'll actually go and repair some of the shorter telomeres. It'll actually add some things to lengthen them. So telomerase is very popular right now as something that we want to that people say we want to increase in our bodies. And there's all these different ways and methods of increasing telomerase. And then of course they're actually looking at injecting telomerase. I'll get into that. Okay, so telomerase is good because it can lengthen our telomeres. Not so fast though. Be careful, because there are a lot of alternative cancer sources saying like, yes, this is what you want to do, because they're not wrong. Okay, yes, there are cancers. There legitimately are cancers that are associated with shorter telomeres. So we want to increase our telomerase because this is going to lengthen our telomeres. That's actually not entirely correct. In fact, it can potentially be dangerous to do that. So telomerase is actually found in cancers. Telomerase is found in 90% of cancers. It actually can be used as a biomarker for cancer, and it's heavily in cancers because the cancer itself uses telomerase so that it can keep dividing and dividing and dividing and not dying. So do we really want to increase telomerase in people who actively have cancer? I mean, honestly, there's not really data to show whether doing anything that increases telomerase is going to go to help the cancer or if it's going to go to help the other cells that need it. We don't know. So, of course, err on the side of caution. So, here is my expert recommendation. If you are in a phase of cancer prevention, or let's say you had cancer, but you're in remission, you don't have any evidence of disease right now, but you're kind of one of those risk groups because it could come back. So if you don't have cancer, whether you're in prevention or, preventing reoccurrence, like you used to have it, but you don't have it right now, then I would say, yes, let's do things to lengthen our telomeres. Let's do things to activate our telomerase. Now, if you actively have cancer right now, I would say no, do not do the things that people are recommending to lengthen your telomeres, because likely that's increasing the telomerase. And that might have the exact opposite effect that you want it to have. That may actually help the cancer. Like I said, we don't exactly know yet. There's not data on this, but it stands to reason because of the things I said already. And also, telomerase inhibition is being studied right now for anti-cancer drugs. That's a target of drug therapy, is to inhibit the telomerase and using that as a way to help cancer. So it just seems logical that you probably wouldn't want to do things that increase telomerase if anti-cancer drugs are actually trying to inhibit telomerase. However, in order for the inhibition of telomerase to work, there still has to be shortened telomeres. In other words, this telomerase inhibition, the subject of drug therapy, isn't necessarily going to work on the cancer. First of all, it's not going to work alone. There needs to be other therapies involved. And it's only going to work if those telomeres are already too short. Therefore, more of a strong case to do things for prevention to keep your telomeres long, then you may not even get cancer in the first place. So, whew, all right. I hope that made sense. Now, let's get into the juice of it. What can we do to protect our telomeres? What can we do? Again, these are things you want to pay attention to if you are in prevention of occurrence or recurrence of cancer. And here's the things that kill telomerase. So in other words, these are things you want to avoid: obesity, smoking, excessive alcohol, lack of sleep, like less than 5 hours a night, chronic stress. Surprise, surprise, stress is always a factor, isn't it? Soda. Did you know drinking 20 ounces or more a day of soda can actually put you in the same risk factor category as someone who smokes cigarettes? And believe it or not, pessimism, again, going back to like mindset stuff, can kill your telomerase. So you might be thinking, well, wait a minute. If killing telomerase is a good thing if I do have cancer, because that's what cancer drugs are focusing on doing, and cancer cells have all this telomerase, that would almost seem like I should be doing those things to kill the telomerase. Well, bodies are complex, aren't they? And of course, we have to have a delicate balance of things. I can assure you that the detriment of things like excessive alcohol, obesity, smoking, stress, all the things I just said, is going to outweigh the benefits it might have on killing your telomerase. So we'll just put that out there. Okay, so here are some things that can help to increase telomerase in your body. Vitamin D. Isn't vitamin D always so useful? But you got to also have sufficient other vitamins and minerals too. They're kind of all needed, but vitamin D is a star. Omega 3s, omega 3s, and then polyphenols, which are a type of compound found in plants. Polyphenols are kind of a broad compound, or category, but it contains things like quercetin, resveratrol, curcumin, catechins, which are found in green tea. So polyphenols, vitamin D, omega 3s, exercise. So especially aerobic exercise. It helps reduce the oxidative stress and inflammation, which can definitely help protect telomeres. So there's a good one. And then diet matters too, just getting in general healthy fats, quality protein, and antioxidants through the diet is going to be helpful. And yes, there are supplements on the market that claim to help your telomeres, and they might be good. Quite possibly, because they contain some of these things. There's a supplement called Telo Vital by Dr. Bill Andrews. I can't say for sure, but it sounds good. There's more actually. I found a study that found these to be very statistically significant telomerase helpers, and in this order too. Gotu kola, Centella asiatica, astragalus, oleanolic acid, and mesclinic acid, and those are both found in olives. And then I just want to briefly mention some things that are still in the research phase. So these are things in the research phase, so you shouldn't necessarily worry about doing them yet. But there is something called TA65. It's very expensive. Now, this is sought out by people who are like biohackers and into longevity and anti-aging. So you don't necessarily need to worry about that. I mean, if you're cancer-free, but you've had it before and you're really worried, I mean, it might be something to consider. But again, it's still in the research phase, so don't worry about it too much. TA65. Also, straight up injections of telomerase. That is a thing too, still in the research phase, just straight up injections of telomerase. Hopefully they're not testing this on cancer patients, because like I said, that might not bode well for people who have active cancer. And then senolytics. Senolytics are still in the research phase, and senolytics are a class of drugs or supplements that basically kill off senescent cells. So they kill off already dying, damaged cells. So it's a good thing. We do want that to happen. Fasting does that as well. But there's drugs that are targeted to do that, like immunotherapy drugs, even things like metformin, rapamycin, which have off-label uses in cancer. And there's supplements that act as senolytics as well, things like melatonin, things like reishi mushroom, Ganoderma lucidum. And notice how melatonin and reishi are commonly prescribed in cancer. Then things like Chinese wolfberry, Lycium barbarum is the Latin name. And spermidine. So spermidine sounds like sperm, but it's not. It's a compound it's a polyamine compound found in the ribosomes and living tissues. So it's found in foods like mushrooms, aged cheese, as well as dried soybean and wheat germ. So there you have it. And just to wrap up and just to make things clear again, if you are in a prevention phase of cancer, or if you had cancer but have no evidence of disease but are interested in preventing any recurrence, then you definitely want to do some of the things that I said and work on avoiding things that destroy telomerase, doing things that increase telomerase, so that you work on, protecting your telomeres and potentially lengthening them. And that's always a good thing to do for preventive health. However, if you actively right now have cancer, you might not want to do anything. In fact, it's probably best to not even, and this is important because this is contrary to a lot of info out there. You want to not do anything to increase your telomerase or to work on protecting or lengthening your telomeres. If you actively have cancer, don't even do that, because sure, we're not sure whether that's actually safe or not, because telomerase is also used by the cancer cells to keep growing and dividing. So if you already have cancer, right now actively have cancer, don't even do any of the things that I said until you're free and clear of disease and in more of a preventive phase. So I hope you found that somewhat enlightening, because it is different than some information that's out there. And as always, you know, do some of your own research and make sure you have trusted sources for your information. And that's why it's always best to seek out a professional to work with. It's way too much to sort through all the information online yourself. You deserve to have somebody that can really help guide and support you through this process. Take a load off. There's me and there's others, other naturopaths, other coaches, other holistic health professionals, but I'm a pretty damn good one. So if interested, you can find a form in the description box to fill out. All right, lovelies, have a wonderful day, and I wish you the best on your journey.